The other thing I also get my patients to do is grounding. Get your feet on the earth, this planet. It grounds your energy, on all your electrons. It's just literally, if you've got high levels of inflammation, get on the grass, get outside, immerse your feet in the sand, in the water, in the river. It anchors your body into this planet. We are aligned with this microcosm, this beautiful planet. And sometimes in this fertility process, it's nice to just use these lovely pillars, earthing, grounding, be on the ground, feel your feet, feel the earth, be here now.
Do you want to wake up feeling like you're stepping into who you're meant to be, into the best possible version of you? What if I told you that the key to your best life, health, and happiness are all around you? You just have to find what works for you. I'm hopeful Jasa, and I believe that there isn't just one way to live a healthy and meaningful life, and that all you need is a little inspiration to make changes that last from the inside out. Each week, I'll be sharing tangible tips and inspirational interviews to help you on your journey. These are the steps to take to improve your life and live with purpose. This is Hopeful and Wholesome. Hey y'all, welcome back to Hopeful and Wholesome. Today I have on the show Dr. Fiona Tassoni. She is a registered doctor of Chinese medicine specializing in fertility. She is a fertility coach with a master's degree in Chinese Herbal Medicine and with 21 years of medical practice and over 32,000 hours of clinical experience. So needless to say, Dr. Fiona knows a few things. And we are talking about fertility today. We're talking about fertility from the kind of Chinese medicine perspective and really what it looks like to help prepare your body for pregnancy, but also heal your body to be ready for pregnancy. And we have a conversation about how so many doctors now are so quick to suggest IVF to men and women who, when really it's often not needed. And she talks to us about ways that we can avoid that if possible, as we all know that is a huge investment and expense for those who have trouble getting pregnant. She talks about how to prepare your body mentally and physically and emotionally for pregnancy and how to improve the quality of your uterus and your eggs. There's so many things we talk about in this. Even if you're not trying to get pregnant, there's a lot of insight you can take away from just women's health in general. So I love this conversation. She's so fun. Let's jump in. All right, y'all, let's jump in. I'm here with Dr. Fiona, and I'm so excited. We were talking before I hit record. This is such a fun conversation because we haven't really talked about fertility, like I told her, and we haven't really dove into deep in traditional Chinese medicine. This is the best of both worlds coming together that she's bringing us. So thank you so much for joining us today.
It's a pleasure to be here.
Yes. And just so y'all know, she got up bright and early because she is in Australia. And so even though she's an early riser, I still appreciate the commitment to getting up for this interview. So thank you. But let's just I would love to get, I love to hear everyone's story on how they get into the path that they're on and the wellness path. So can you just kind of give an overview of what you do and why you chose this particular path?
Well, it came from an injury that I sustained when I was 15. I had a water skiing accident. And from that accident, I got dragged behind the back of the boat coming up on one ski. And I let go of the rope. It wrapped around my arm and dragged me. So I was just, my pelvis was displaced. I had a posterior bulge. So it was an injury that I sustained. And basically I had lots of different therapies over the period of 6 years. So up until 21, I tried physios, chiros, osteos, kinesiology, massage. GPs offered me drugs, opiates and things like that. But I preferred to, deal with it naturally. And I tried acupuncture as a last resort. So I got into Chinese medicine through my own injury, basically, while I was living in London, living and working, as Australians do, traveling the world. And I tried acupuncture this particular day because my back was just in so much pain. But I had been in a prison of pain for about 6 years. And so I tried acupuncture this particular day. And the first session improved my pain by about 50%.
Oh, wow.
And yeah, this little gentleman gave me some Chinese herbs as well. And he said, come back in 2 weeks. And I came back in 2 weeks. And literally, by the second treatment, the pain was gone, vanished.
Wow, that's crazy.
And the x-rays confirmed no more posterior bulge. I could not believe that these little needles, and whether it's the combination of the herbs as well as the needles, but it literally brought me out of this prison of pain, because I had varying degrees of pain for about 6 years.
Wow.
Yeah, so it was quite miraculous. And I think when something like that happens to you, you just want to dive in, know everything about what is Chinese medicine. So Chinese medicine became such a passion for me, and the Tao Te Ching became my travel Bible, and just even now it's a way of living. I love looking at the Tao Te Ching and just, it could be a meditation for the day and live by that.
Yeah.
So then literally I started with acupuncture. So I did an undergraduate degree in acupuncture, and I was realizing that there was something missing. And I didn't realize that when you train in China, that most practitioners do the acupuncture and the Chinese herbal medicine. So I went on to do further studies. I did my master's then in Chinese herbal medicine, and then found that was a good balance, because really, the acupuncture will work from the outside in and the herbs work from the inside out. Getting the balance of both. So, and then the fertility stuff came later. I found that, when you're working with patients, the menstrual cycle is one of those pillars of health. And because whatever I was working with, the menstrual cycle was always something I spoke about. So I was always finding there were issues with women's gynecological menstruation. There was amenorrhea, dysmenorrhea, clotting, fibroids, what have you. And so I just started to find a real passion with that, and then started to train under international fertility experts and started to specialize in that area.
I love that. That just happened naturally. So I have to ask, this is totally unrelated, but you mentioned it, and I've had, a handful of Aussies on the show, and I love the fact that, at least, I don't know if I can speak in generalities here, but I'm going to. I feel like all Australians, like you said, like go travel the world. Like they go off to go to school and they go here. Like I love that so much, that y'all are such like cosmopolitan world, like I just love that. Is that like a typical thing for Australians?
It really is a typical thing for a lot of Australians. I mean, when I was at school, most of us travelled.
Yeah.
Even if it's around Australia,
Yeah.
and it's, like picking blueberries and farming. Some go to kibbutz over in Israel and things like that. But I find the majority of Australians will travel Europe, or, a big majority of us will use London as a base because we can get the work visa.
Yeah, that's true. Yeah. That's so cool. I love that. I just had to ask. I'm like, this seems like such a common theme, and I just love that about y'all so much.
And when you look at it, we're so far away. Australia is so far away from the rest of the world.
Right.
So if you traveled from Australia to, you couldn't afford to do that.
Right.
From Australia to London, or Australia to Europe, or Australia to South America. It's just too expensive. But when you're based in London, you can just travel, and it's
everywhere.
Yeah, it makes sense that if you're wanting to explore the world, that London, it was a really good base for us. And it was one of the best things I have ever done. And I think it's the best degree I've ever got, is to travel the world. And I recommend that, before you study, see the world, because it opens your mind. And I just realized that I became such a different person when I started to experience different cultures, different ways of looking at the world.
Yeah. Well, and I think, leading into our conversation, I think it's just the life experience and just the exposure. I mean, it lends well to everything that you do, even if you're not studying everywhere you go, but it really just the life experience and witnessing all that. It just, it helps you as a person as you like grow and evolve and your spiritual journey. And so, I mean, it does play into you and how you're performing and your practice and all of that.
Yeah, and you can have judgments about different cultures. Like I remember my best friend and I were in Turkey, and we went and had a Turkish bath. And, we could not speak the language, and we were with these beautiful Muslim women that brought their families to bathe. And it was so liberating to be amongst these women that were so liberated, even though they're covered up on the street. In the bathhouse, they are so liberated with their bodies. And I was truly inspired by that experience with my girlfriend. We stayed there all day. I was waterlogged, scoured and scrubbed, and we sat there, we bathed with them, we steamed with
That's
them, we
so
went
cool.
sauna. And it's really has transformed my whole perspective on how we can judge cultures until
Totally.
you step into their domain.
Yep.
It was one of the most liberating experiences
Yeah.
I've ever had in
I
my
believe
life.
it. I believe it. I totally believe it. And I'm going on a retreat in Tanzania this summer. And that's one of the things the gal leading the retreat was talking about. Like, we've been, because my husband is scared, like he's like worried for, my safety. And she's like, it's one of those things we've been basically brainwashed our whole life. Like Africa is this horrible place and it's so unsafe. And now granted, of course there are places, but there's places anywhere. Like you can go to Chicago in the United States and it's not safe, So, but she was like, we really have so many, like you were saying, so many preconceived notions about what we think. And, she's been there before and she's like, I've never felt so safe. And that you just don't know until you go. And like, we just have so many preconceived notions about what we think cultures are like. And we really have no idea until we experience it. Right.
Exactly. Africa was another trip. See, that was the trip that I did, another trip while I was in London and traveled there. And it was incredible. We went from Egypt all the way down to South Africa.
Oh,
And
wow.
and we used every means of public transport. We didn't
That's
do
so cool.
we climbed Table Mountain in Cape Town. We,
Wow.
went down the Felucca on the Nile. We whitewater rafted down the Zambezi
Oh
on
my
Great
gosh.
Rapids.
That's
I
crazy.
mean, I saw the gorillas in Uganda.
Oh my gosh.
And I just felt this sense of freedom. And I felt when I was in Africa, I felt so connected with the land and the people and everyone. I mean, it's so cliche, but it's Hakuna Matata.
Yeah, right? It totally is.
It's no worries. And
Uh-huh.
everything slowed down for me when I was in
Yeah.
Africa. And I got to appreciate the real simplicity of sharing a meal with whatever community I was in. They were so generous and so welcoming, and the big smiles and the
Yeah.
eyes that sparkle. I mean, I would go back to Africa in a heartbeat. It's one of my
That's amazing.
favorite places.
That's what everybody says. And the gal leading the retreat, she says the same thing. And she was saying like, in a spiritual sense, she's like, I know this sounds woo, but we all started from around that part of the world. She's like, so it's like your spirit, you get there and your soul, like your cells know, like I'm home like this. And she's like, it's just this feeling that you can't describe. So I can't wait. I can't wait.
I've got goosebumps for you.
I do too, thinking about it. I haven't even been yet. I'm so excited. Oh my gosh. I digress though. I want to talk to you about that. I could talk about that all day with you. And I'm going to have to pick next time I go on a trip. I'm just going to have to message you and be like, okay, what do I do? You've been everywhere. I love it. I love it. Okay. So I do want to talk about fertility though, because that's why we're here today. And I do want to talk about kind of what you do in terms of tying in the traditional Chinese medicine. But I want to kind of what we picked at a little bit before we hit record. So many people are so quick, and this is, I'm saying this without judgment. There's no judgment here, but so many women and families are so quick to jump to IVF because, they're struggling to get pregnant and that's what their doctors are recommending, right? But you really believe that people are jumping a little too quickly. Like there's things that they can actually do without having to do IVF. So can you, I guess, I would love to hear your thoughts on that and what you recommend for your patient, your clients and stuff that you work with.
Well, I think that it is about awareness. What I do understand is that a lot of doctors don't realize that traditional Chinese medicine and using acupuncture and be it yourself using holistic nutrition, that you can heal the body in so many ways. You can fix a lot of these gynecological parameters that might be breaking down, whether you've got amenorrhea, dysmenorrhea, fibroids, clotting disorders. There's so much that alternative medicine and Chinese medicine can do to help that and fix the root of the problem. But I just think that doctors are unaware. They are looking through their lens and they see that, okay, there's an issue here, we're going to fast track it. So that's their protocol. That's their, the stepping stone is, all right, let's just offer IVF.
Yep.
So that's where I want to bridge the gap and open up this awareness that you can try alternative therapies to help you with declining sperm counts, with low AMH, with high FSH, with poor egg quality. we have so much that we can use just with herbs, nutrition, supplements, diet and lifestyle, and we can fix those problems relatively fast before we step into IVF. But it's just that doctors don't know that this is possible.
Right, for sure. Yeah, I mean, it's we talk about this a lot on the show, and it's just not in their scope of expertise, really, like the alternative means, right? It's just not.
We're making some breakthroughs in terms of the acupuncture. Like now you'll find a lot of GPs and a lot of doctors are, training in acupuncture.
That's true.
Like physiotherapists are training in acupuncture, even though it's called dry needling.
Dry needling, yeah.
They're doing dry needling. It's still under the banner of acupuncture. So the message is getting out there, but these conversations open up the conversation, and it's great for women because it means that with Chinese medicine and alternative medicine, there's little to no side effects.
Right.
As opposed to jumping into IVF and you've got all these side effects to all these drugs.
So many
and
hormones.
So I'm usually having to work with women that are doing IVF to fix the problems of all the side effects of all the drugs and all the emotional stuff and gynecological or bloating and, just different things that go wrong with IVF.
Yeah, for sure.
It's not an easy ride for most women. Some women experience that journey and it's quite relaxed and it's quite fun. But the majority of my patients that are going through IVF, it's a really arduous, it's hard on the body.
Yep, for sure. And that's, the people that I've known, family and friends that I've known that have gone through it, I don't know any of, and I know, like you said, I know what happens, but I don't know anybody in my little circle that has ever had a good experience with IVF. So, it is hard on the body. And then too, I've worked with women. I haven't worked with any women that have been on it, like while we're working together, but I've worked with women who have done it before. And, and there's so many long-term side effects of things that just kind of linger in the body after the IVF too. And, I've had to help them kind of work through those pieces.
Well, this is where the beauty of us working together with the Western medicine and the Eastern medicine is that if you are doing IVF, having your acupuncturist or Chinese herbalist along the way that can do the acupuncture, pre and post transfer, pre and post egg collection, like this can really help mitigate those side effects. Yeah. So you'll find a lot of IVF clinics now in the US and even in Australia, they have in-house acupuncture.
That's awesome. That's amazing.
Really? It is really amazing. So look, it's changing, but these conversations open up the awareness, and I think that's all it is. Women just don't realize that you don't need to jump straight in. Like give yourself 6 to 12 months. Try some acupuncture. See a holistic nutritionist. Try a dietitian. Try some Reiki or some kinesiology, some energy medicine to balance your chakras and your energy centers.
Yeah, that's exactly it. And I think that's the thing, right? Which, and again, I get it. Like people who are longing for that, they want the baby like now. And so they don't give themselves that kind of runway to prepare their bodies. And let's see what I can do for, so I agree. Giving yourself that time and space is important.
And I think that's the greatest gift. I tell all of my patients, the greatest gift you can give yourself is time. Time to heal. And you've got to remember that the body, we've got to lay the foundation, which is why, I've got my new book that I've just written and it's just been released on Amazon. It's all about preconception. It's all about getting the body ready for pregnancy. And, and it's about doing that groundwork. And we need about 3 months. We need 3 months to improve egg quality. We need 3 months to fix the lining and anything that's going wrong in your menstrual cycle. We need 3 months to improve those declining sperm counts and all those parameters, whether it's morphology, motility, volume, concentration. All of these things can be improved in 3 months. If you give yourself at least 3 months, but I'm saying give yourself 6 to 12 months, ideally. Ideally.
And I do want to ask you about the specifically looking at like the egg quality and the lining and all that, and then the sperm count. And not that, you're not going to go through your whole book here, but what are some of the things that you might recommend we'll start with the women in terms of like egg quality and the quality of the lining and all of that. What are some things that you recommend for women in that part?
Well, if I break it down, I have a lot of patients that come to me, and sometimes I've had women give me spreadsheets
Oh,
of
wow.
all the supplements they've been prescribed,
Yeah.
and I'm like, oh my God, this is giving your body way too many commands,
Yeah.
and I don't think that's healthy.
Yeah.
Really, you've got to remember that supplements are there to supplement the diet.
Exactly.
So it's about getting the diet right. But if I'm going to break it down and just say, all right, what do you need to improve your egg quality and improve your fertility, right? So for women, I'd be looking like my first basic supplement that I've got every single patient on is a preconception multivitamin with activated folate. And it needs to be activated folate,
That
not folic
folate.
acid, which is
Yes.
synthetic. Yeah, it needs to be activated folate or methylfolate. It's written a few different ways. That's the number one. Then it's throwing in your omega-3s. So your omega-3 fatty acids, your fish oils. All right. That's, we need that for, inflammation. We need it for egg development. We need it for fetal development, brain health. So that's the second thing that I would be recommending to women. And then CoQ10, we want to look at, that's the energy house. It's like the antioxidant for the cells. So we want to look at the mitochondria and give that CoQ10 to the mitochondria. It needs that energy to reproduce, to develop. So CoQ10 is something that I have all my patients on, and I usually follow that all the way up until they finish breastfeeding.
Yeah, those are good. Those are all really good. What do you? Yeah, go
They're the
ahead. Go
three
ahead.
main ones. I still haven't finished.
Yeah.
Vitamin D, I just find most of my patients are deficient, depleted, because we've got this sun campaign. And don't get me wrong, I'm a fan of slip, slop, slap. But because we have got the sunscreen on, we've got the hat and the sunglasses on, we don't get the vitamin D. And we're not getting that vitamin D synthesis, and we need that for egg quality. We need that for mood. We need it for your bone density. We need it as COVID protection. It's so important. So I have everyone on 5,000 IU of vitamin D, and I'm also big on sun gazing, like sun gazing with the sun in the morning when the sun's on the horizon, looking at the sun, or at sunset, or just getting 10 minutes on the face, on the skin, just bask in the sun. 10 minutes to 20 minutes a day is so important. We could go into further things, but that's the basic strategy that I would give people and then you can tailorize it. If you've got PCOS, I might add in ALA, alpha lipoic acid, or inositol, and you tailor the supplements depending on what they need. If you've got a thyroid problem, hypothyroidism and underactive thyroid, I will throw in selenium, because high doses of selenium help the thyroid function better. They also lower down the TPO antibodies if you've got autoimmune diseases. If you've got sleeping issues, I'll throw in melatonin, and we often use that for, egg quality. So you can see that the supplements are tailored to each patient individually. And I'm a big fan, and I'm an advocate for less is best.
I agree. I agree with you. I agree. Yes. Yeah, it really is. It really is. Well, and I love what you said about the sun, because I am very careful in the sun. I'm like, my sister has had skin cancer cut out of her. My mom has had, and so it's like, it's very common in my family. And so I have been, especially like starting my late 20s, I was like very like, oh my gosh, like at the beach, I'm like totally covered up. But I've gotten now over the past probably year cause I'm like, well, crap, I'm not getting anything from the sun, right? Cause I'm totally covering myself up from head to toe when I go out to the beach or whatever. But I'm getting over the past year, I've been really good about getting out. And like you're saying that, like for me, it's like 15 to 20 minutes is perfect. And like getting going for a walk when the sun is out, no sunscreen and no hat, just getting, and that there's like a sweet spot, because you do need the sun. Like there's a reason that we need the sun. There's a reason plants and things grow with the sun. Like we need the sun, but it's that fine line.
The sun is the giver of life.
It is. Yes.
I worship the sun.
Yes. It's
I'm
so true.
worshiper.
Yes. It's so true. Well, and you really, I was just talking about this on an interview I did the other day. You really don't, I think we really underestimate. I mean, I guess, especially in the Western world, I'm sure the Eastern world is better at this, but I think we underestimate how much the sun affects our mental health, our spiritual health, our emotional health, like just how much we need it, and just being in the outdoors.
It's also our cortisol awakening response. We
Right.
call it the CPR response. So, first thing in the morning, if you've got high cortisol or even low cortisol, I just find that if the first thing your waking thought will be to open the blinds, face the sun, and light up.
Yes, it's exactly it. It's exactly it. I had a gal come on a while back who was talking about red light therapy, and she's talking about like get out when you get the red light, when you're like you're saying, like watching the sun come up, and that's when you get the red light and like the benefits of the red light. But it is like the sun. We need the sun.
We do. We do.
Yeah.
And it's a simplicity. Infertility, because it gets so complex.
Yeah.
Women they get so, it has to be this supplement and this supplement. And I'm like you really have to kind of relax them into this. And so it's giving people the sunshine. Like I would rather you do the sunshine than take the vitamin D.
Totally.
Like if you learn to soul gaze, and it's only like 30 seconds to a minute when your sun is directly on the horizon, and you bathe and bask in that sunlight, you're getting about 20,000 IU of vitamin D.
Wow.
We can't synthesize that in our own bodies.
That's so true. That's so true. That's crazy.
Yeah. 1 minute, 20,000 IU.
That's nuts.
Like light yourself up, and it's like straight into that pineal gland. It lights up the endocrine system. It's so good for your hormones. It's my favorite thing to do. So my waking, if I'm not on coaching calls, my favorite thing is like I rise with the sun and just watch the sunrise.
I love that. That's amazing. And it's funny too. I was just I think it was a video on Instagram, but it was this guy talking about like artificial lighting and how much like artificial lighting and affects like our hormones and all of these things. And he was talking about like the worst types of lighting and the best types of lighting, and how like the lighting back in, I don't know, 40, 50 years ago was totally different than like the fluorescent lighting and stuff we have now, but how much that affects our hormones. And he was relating to some about the sun, but we don't think about that too, like how the sun and like natural lighting is how much it's affecting our hormones, and how the synthetic lighting is affecting it the opposite.
Yeah, the other thing I also get my patients to do is grounding. Get your feet on the earth, this planet. It grounds your energy.
Yes.
All your electrons. It's just literally, if you've got high levels of inflammation, get on the grass, get outside, immerse your feet in the sand, in the water, in the river, whatever you've got outside. If it's a little patio with a little patch of grass, then, it's the same thing. It anchors your body into this planet. We are aligned with this microcosm, this beautiful planet. And sometimes in this fertility process, it's nice to just use these lovely pillars, earthing, grounding, feet on the ground, feel your feet, feel the earth, be here now. Like it's a beautiful, we use in Sanskrit, we call it atha, which is it just means be here now. And so when women are so in their minds with this fertility process, and anything you can give them to earth and anchor and just be in their bodies, I find those simplicities, those simple pillars are incredible.
Yep, for sure, for sure. So what do you recommend for the men? And we're talking about, sperm quality and the things that the men are responsible for.
So very similarly. So it's the preconception multi with activated folate, because remember that men are giving their 50% of the DNA to this equation, and we need to make sure that they're methylating properly with the activated folate. So we want the preconception multi with activated folate, about 400 micrograms of activated folate. Then it's again your omega-3s, your vitamin D, your CoQ10, because we need that for sperm health. Now, I do add in selenium because I love selenium for free radical damage with sperm. So I will often throw that in. I find guys tend to be very inflammatory creatures.
Yes.
With takeaway and fast foods, and they're on the go, and they're just the alcohol and, So I like to throw in NAC, N-acetylcysteine. So it's a precursor of glutathione, and it decreases inflammation, but it works on that free radical damage, and it just helps the sperm. It's great for motility. It's great for morphology. So that's how I would tailor it for a man. And clearly, if they've got things that are going on, some of them might have gut issues.
Right.
I find a lot of them do. So I'll often throw in a probiotic with the guys, just one a day. I mean, I would love them to step into sauerkraut and kimchi and, ferments with food. But
yes.
I often find guys, it's easier for them to just do a probiotic. Because we need to clean up the gut. I find that there's a lot of gut stuff going on with the guys. And equally with some of the women, there's a lot of IBS. So, probiotics are a big thing that I will recommend with both. But yeah, that's the breakdown for men. I like to keep it concise and simple.
Yeah. I love that.
You can add in things like tribulus or L-carnitine, if there's androgen deficiency. But as I said, you just tailor it to the patient and what they need. But it's just the basics. You want to get the basics, your preconception multi, your omega-3s, your vitamin D, your CoQ10. Like that's just 4 basic things.
Yeah.
They're your basics.
It's simple.
You stick to the basics. Simple.
Yeah, it's simple. No, I agree with you. And, I'm a huge proponent of supplements. I use it in, with my clients, but it's always, and for me, I have different stages that I work with my client. We work in stages depending on what we're dealing with. And there's different supplements we do at different stages. And I find that a lot of times they've been to other practitioners and they just throw everything at them all at once. I'm like, no, you can't take like 12 of these at the same time. Your body doesn't know what to do with all of that.
Yeah. Like initially when I start working with patients, I'll often do a detox because it's like the cleanup.
Yeah.
So, when you're detoxing, you're not going to give them a lot of these supplements. I tend to claw them all back when I'm detoxing because we're working with clearance.
Right.
So you might be working with, milk thistle and things that are going to help clear the liver and then you start to re-add things in. So I do understand there's different stages along the way.
Exactly. Yeah, exactly. Do you have, as we're kind of wrapping up the conversation here, do you have any last strategies or tips or just things that, maybe women who are going through the fertility process don't know that you want to leave the listeners with?
Yeah. Things that I like to impart is castor oil packs. I find they're really helpful.
Love castor oil packs.
Yeah, it's great for that detoxification, but also we use it in that follicular phase. So after you finish menstruating, say day 5. So from day 5 leading up to ovulation, we use it in the follicular phase and then stop after ovulation. And what that does is it just helps mature the follicles. It helps with ovulation. It helps with menstrual disorders. So it helps with bloating, for example. So castor oil packs are really simple. So I have all my fertility patients doing castor oil packs. In that particular phase. Second thing, the femoral massage. It's a reproductive femoral massage. And it's just occluding the femoral artery. They can do that, again, similarly in that follicular phase from day 5. You want to, occlude the artery about 30 to 60 seconds, let it go. Do it 3 times on each side and then repeat the other side or alternate. And what that reproductive femoral massage does, it's a massage technique that you can do it on yourself. You can do it on your husband or he can do it on you. Or I have the quick version where I get women to lay face down on a tennis ball and just put the tennis ball underneath the femoral artery because it's like on the panty line. Now, what that does is it stimulates the blood flow to the ovaries, to the uterus. It's just a simple technique. So I love giving people strategies that they can use and do it every cycle. Don't miss a day, right? And it takes 3 minutes, if that.
So easy. Yeah, it's so easy. Those are so simple.
Simple. Now, because you've already got the castor oil, right? So you get your Chinese soup spoon, but if you don't have that, even a normal soup spoon, as in a metal spoon, and we do abdominal gua sha, which is a scraping of the skin. And what you do is rub the belly with the castor oil, and we're just scraping from the pubis to the navel, about 3 strokes, and then we go out diagonally towards the ovaries and the hips. And that's another practice you can do in the shower. From day 5 leading up to ovulation. So they're my 3 little tips, all right, that I like to impart. Now, the guys can even do this. Sometimes I have husbands that are a bit resistant and I'll say, just rub some castor oil over his belly and then literally put a T-shirt on him and he can do it every night
Yeah.
So the guys, it's going to help with the bloating. It's going to help with the liver. It's going to help with, the motility and morphology of the sperm. It's going to lower those inflammatory markers. So guys can get on board with this too. And I'd say, if you're in the shower together, do the abdominal gua sha.
Yeah. Yeah. Those are such good tips.
Cute little tips.
Yes. I love them. So easy.
Fun.
Yeah.
Exactly.
Yeah. It's so easy to do.
The last tip I give is I love to impart fertility qigong. And qigong is like, it's Chinese yoga.
Mm-hmm.
And it's breathing techniques, but it's just my favorite exercise is called swing arms. And it's literally you're swinging your arms forward and back, right? And when you do this, the Shaolin monks say 300 swings of this is about 6 minutes. It opens up the entire lymphatics.
Oh, wow.
It allows the circulation to work from the heart to the womb, from the heart to the testes, all right? And it just makes you feel good.
Yeah.
Releases the neck, shoulders, and it's like, I can do that for 6 minutes.
Yeah.
I have all my patients doing the swing arms because it's like, there's your exercise.
Yeah.
There's the blood flow. Because people get stuck. They get stuck in the neck and shoulders, or they're stagnant, they're not moving. I'm saying do the swing arms in your chair. You can either be standing or sitting, preferably in a horse riding stance, standing. But that simple technique, it does so much for your circulation and blood flow to your reproductive organs. And remember, all roads lead to the palace. We call the uterus the palace for the child. So we want to send all that energy to the palace.
Yes, I love it. Those are so good. Oh my gosh, such great tips. Well, and I feel like even if you're not on your fertility journey, everything you just said is like beneficial just for your health anyway. So like, just do them anyway.
Without a doubt.
Those are so good. I love that. Thank you so much for sharing those. So before I have one last question I want to ask you that I like to ask everybody as we wrap up. But before I do that, can you let everybody know where they can find out more about you and then your book? Because I know we talked about your book.
So I have a few different places you can find me. I have a Pregnancy Accelerator Program. It's a Facebook group where women from all over the world can join the group and ask me any questions and have their questions answered. And it's just a beautiful community of support of like-minded women that are going through this journey of trying to conceive. Some have already had babies and they share their baby pictures and their lactating stories and all, it's just a beautiful forum. So that's Pregnancy Accelerator on Facebook. I'm also on Instagram, Dr. Fiona Tassoni. And I've also got pregnancyaccelerator.com, which is my website.
Perfect. Awesome. And of course, I have links to all that in the show notes and the link to her book that she mentioned earlier. So I'll put that, and there it is. You can show it. Yep, there it is. We're going to put the book down there. And she has also given me a link for you to get the book for free. So if you or a family member, a woman in your life is going through her fertility journey, please go to that link and get the book for her. It's so generous of you.
It's a gift I wanted to offer to your listeners. So it was launched on Amazon last week. It's 332 pages, and it's just a beautiful book that covers most of what we was talking about, but in greater depth. And it's just your fertility guide. It's your helping hand along this journey. And I wanted to offer that for free. Like there's a small cost, but that's to all your listeners.
It. Thank you so much. It's so generous. Thank you so much for that. The last question that I want to ask you that I like to ask everybody is, what do you think is the most important thing you can do to live with purpose?
I think the most important thing you can do to live with purpose is being present. Being present with yourself, being present in the moment, being present with others. Because when you're present, you listen, you're true to yourself, you're authentic. So I think being present is probably the greatest gift you can give yourself and to humanity.
I love it. Such good advice. Thank you so much, Dr. Fiona. This was such a good, there's just so many tangible things in this episode you shared. So thank you so much for your wisdom and your insight and your generosity and everything that you're doing.
Thank you for having me on your show. Thanks, Hope.
Thanks for listening to Hopeful and Wholesome, y'all. If you found value in this week's episode, please subscribe on iTunes or wherever you listen to your podcast and leave a review to let me know what you thought. I'd love to know what you find useful in these episodes so I can know how to provide the most value I can to my listeners. And if you have topics you'd like to know more about, I'd love to hear those as well. So shoot me a message on Instagram, Facebook, or LinkedIn, It's at The Hope Pedraza, or you can visit my website, hopefulandwholesome.com. Thanks, y'all.